Thank you so much for being with us here on ITV Gold, Gary Pasricha. You are representing the Punjabi Chamber of Commerce. I have to ask you right now, how are you doing and how is the Chamber doing and how is your team of volunteers doing right now?
Well, we're all luckily safe. That's what counts. And we're all working very hard to help all our members and our communities right now.
Right. I kind of wanted to just dig right into what's happening in terms of the relief efforts by PCC. I know it's a huge organization for networking and also the Punjabi culture and the community. But right now, the Punjabi Chamber of Commerce is doing some incredible work both here in the US and in India. I would love for you to reflect on some of those aspects and the programs going on.
Okay. Well, we formed the Punjabi Chamber Foundation, which is the charitable arm of the PCC. And with God's grace, we got some startup capital from donations from the trustees and our members. So we're raising money right now to help the frontline healthcare workers primarily. So
Right.
we're buying PPEs and primarily masks. That's our main thing. And we're providing food to the frontline healthcare workers, and we're buying food. Actually, we're providing donations
Hmm.
at food banks as well.
Wow, talk to us a little bit about the relationship with hospitals, and what did you see was needed in those hospital spaces in terms of food or in terms of these PPE. What has the thought process been for the chamber since COVID kind of hit the country?
Well, to be honest, we didn't even know that we're going to do this.
Right.
And what happened is that the community started telling us about the grave situation that's at the hospitals. One of our trustees is a physician,
Hmm.
and he told us as well about the situation at the hospitals, and we started speaking to doctors as well. And we realized that we got a real big problem here, and especially in the tri-state area.
Right.
And so we started noticing that there were doctors who did not have even masks. They were told to wear only one mask for the whole week, believe it or not.
Oh wow.
And so it was very, heart wrenching for us. And then I don't know if you know this, most of the hospitals have closed down their cafeterias.
Okay.
And so before, the hospitals were providing food to the staff through their cafeterias. Once those cafeterias shut down, the hospital workers really had to fend up for themselves for those for the
While
food.
while they're taking care of the patients,
Sorry.
while they're taking care of the patients, they have to look
Yeah, yeah,
at
and right, and also as you know, they were working 12 to 14 hours a day, risking their lives, and they didn't have time to even bring food from home because literally, I was speaking to one physician in Kings County
right.
hospital, and he was telling me that essentially all they're doing is they're going to work. And as soon as they come home, they're sleeping, and then that's it. They're going right back to work. They don't have time to shop. They don't have time to even spend time with their own families. And I thought the least we could do is give them some PPEs at the minimum, which is a very minor thing, and of course, provide for their food.
And this was all done via donations through PCC. Talk to us about how much has been raised so far, and also the hospitals and the facilities that you have, either partnered with or provided for so far.
Yeah, so we've raised in about 10 days about $33,000
Oh,
as,
wow. Right.
as of this morning. Yeah, and we're still getting donations daily, and so we were able to help quite a few hospitals in the area, and we're adding more to our list. And all we're doing is we're asking the members or the community, hey, tell us where there's a need. So, for example, in New Jersey, we've of course have done Robert Wood Johnson Hospital in New Brunswick. We sent PPEs to Palisades Hospital as well. We've sent food to JFK Hospital in Edison area, right? We have a lot of food deliveries going out today as well to 2 or 3 hospitals. Two of them in Newark. University Hospital in Newark is the main one that we're servicing. We've sent PPEs to Kings County Hospital, which is one of the busiest emergency rooms in all of the country. We sent PPEs to Queens Hospital
Wow.
in Jamaica. And we've also have today, I believe, we have a shipment going out to Wyckoff Hospital in Brooklyn as well. So what we're doing is we're saying, look, of course, the Punjabi community is raising this money, and even non-Punjabis are donating. So it's not just Punjabis,
Right.
but we're giving it to everyone, and irrespective of their background. This disease, as you know, affects everyone equally, and we just want to do our little, part to help. That's all.
And if I was to ask you if there is a plan for future for the next couple of weeks, since you are already donating PPE and food donations to hospitals right now as we are speaking, what is the focus for the next couple of weeks for you and your team right now?
Well, the focus might shift a little bit because we think that the hospitals will start getting some money in through the CARES Act and some additional money that may be coming hopefully this Thursday if the Senate passes the additional bill. So we think that we're probably going to have to move to support help hereafter. So as you know, we have a lot of businesses who are struggling.
Right, the smaller businesses.
Yeah. And so just to go back, one of the things was that we have a lot of participating restaurants from our chamber,
right,
who are donating food, and we are providing them the funds to for the deliveries of food to the hospitals. So that's been really nice to see the community come together. So I would say almost all of the restaurants have donated. About 20% of each delivery they've donated themselves. And the PCF, the Punjabi Chamber Foundation, is picking up the cost for the remaining 80-90%.
So you are empowering small businesses via that because they're getting paid for their service as well. That's such an incredible thing to do. What are the plans do you have in mind right now for small businesses, since that is a huge focus of PCC?
Yeah, so one, of course, is to be there for support and to help them apply for loans, to provide them proper information. And so a lot of people just don't know what to do. And I'm sure you've heard that a lot of people applied for loans or were trying to apply for loans and were unable to get them. So we've been shooting them emails, documentation. And so we're probably going to hold a few webinars as well, just to give them some background and some basic information to avail themselves of the benefits in their respective jurisdictions.
And in terms of activities for PCC, I know a lot of nonprofits such as yours are now taking it to virtual to really promote the missions and all of the efforts and the works from the amazing foundations and chambers such as yours. Are you going to be doing a lot of virtual events and still providing enough opportunities for the members of Punjabi Chamber of Commerce? And in terms of the programs, such as your gala events and other events, what's happening in terms of that?
Yeah, so, this was a surprise as to, most groups and definitely ours. We have 13 chapters worldwide. And I think this is a golden opportunity for us to really accelerate our virtual networking opportunities. And so we are launching webinars. We're doing virtual networking events. And, remember, we're a free chamber. We don't charge the community any money to join. We're a very different type of chamber. So, it's just, punjabichamber.com. It's really simple. Anyone can join. And we're just saying, hey, just get to know each other. And if you can, you need business, let us know. But if you can help, let us know as well. So we're just, trying to connect people. That's all.
And what are some of your upcoming projects or some of, the focus for this year in terms of the Punjabi Chamber of Commerce post-COVID?
Yeah, so post-COVID, I think it's going to be really focusing on getting resources to our members as much as possible. That's going to be our major concern, because we think a significant number of businesses won't be able to open. And we're setting up a resume bank as well. So and that's going to be in the free, the open part, I should say, not that everything is free, but the open part of our website. So we're getting that developed because we have a lot of people who are laid off and who have wonderful skills. And so we're going to showcase those people, and we're going to say, okay, upload your resume, let us know what your specialty is, and then we're going to do outreach to other potential employers and
Right.
hopefully connect the two. So that's our major one initiative. The other thing which we've done recently, which I'm very proud of, is that's really from our Washington D.C. chapter.
Mm.
They started a networking hub and for a volunteer network hub.
Mm.
And they did this on their own initiative. They invested their own time. And so, we'll give you information on our website for that. And so they are just testing it, but they have that a component where when, in our community, we want to help. How do we do it?
Right.
So this is linking the people who wish to help and people who need help. So that's one of our other initiatives that we're working on. And we are going to be doing a lot of webinars and seminars as well to give information for each of the, in each of the chapters as well.
And we know that the Chamber's focus is also on young professionals and the South Asian youth as well. So any programs upcoming there for the South Asian youth?
Yeah, it's really going to be on you guys, to be honest. As you know, most of our leaders are in your age group, and we're proud to say that. So we are very excited as to seeing what everyone's going to be doing. But I would say the primary focus right now is going to be two things with the youth camp, let's say. It's going to be basically getting them jobs.
Right.
And that's our first real thing, getting them jobs. Second, helping entrepreneurs with their businesses and giving them basic guidance, access to resources. And we're looking at doing a virtual pitch session. So people who are qualified investors, and we're going to link them up with people who are looking for funding. So that's that's in the works as well.
And for the community that's watching you on ITV Gold, Mr. Pasricha, what should they do if they want to contribute back to the ones in need? Or perhaps how could they, volunteer with the Punjabi Chamber of Commerce right now? Especially for the COVID relief. I know a lot of the members of the community would like to give back.
Yeah, so look, there are a lot of ways to give back. We're not the only way, obviously. For us, it's really simple. You can just go to our website, and we have a donate button right there. Our website is punjabichamber.com. It's pretty simple. And, punjabichamber.com. And you can hit there. We have a GoFundMe page as well under the Punjabi Chamber Foundation. And so that's one way to get involved. Join. Same thing. It's on the site. It's free. We're not asking for any money from you guys. We just want you to get involved. If we don't know you exist, we can't help you. So it's really simple. That's one thing. The other thing you could do really is in whatever small way you can help. The best way, actually, we're saying is, stick your head out the window a little bit and look at your neighbors. If you have an elderly neighbor who needs help, please help them. If you're going to the grocery store, you're doing a grocery run, maybe you can pick up some milk or eggs or whatever they need and just help your neighbor. And a lot of us, unfortunately, do not speak to our neighbors. So, that's really it. That's the most important thing. It's just such a small thing to do, is just to really look around and see who you can help. And it doesn't take much. And if you see a friend in need or anyone in need, give them a helping hand. Now's the time. There are no other organizations, especially in our South Asian community, that are focused. We have a lot of undocumented workers as well, as you know, especially in the cities. Some of those people who lost their jobs, they're not qualified for unemployment. They're not going to get anything.
Yeah.
So, reach out to them. If you know who they are, please give them a hand. If you can give us their names, and if they need help, then we will arrange something for them as well. Okay, so we haven't used up all our funds because we anticipate that there's going to be a need, especially for the undocumented workers, and how we can get them really some much needed help. Sometimes it's just a matter of providing for food, for basic food.
Yeah, and that's truly very important. Just basic food, basic shelter. I think we're
Yes.
all hoping that the communities in need truly get it. Thank you so much for talking to us here on ITV Gold. I would love for you to give a message out to our audience, but also to the medical workers and the healthcare workers that you have also communicated with.
Well, the message is this: we can always complain and say the government should be doing this and should be doing that. But what we realized is that these complaints don't get things done. So our job here is to do our little part, and we're not going to solve the problem. Of course, the government should have been paying for PPEs. Of course, the government should have, done more testing. That's not the point right now. The point now is, what do we do? We're in this situation. So let's, work together and do the best we can to help our community. And as for the frontline healthcare workers, many of whom have lost their lives, I mean, we are really indebted to them. They are really true heroes. And you'd be amazed at how much they've sacrificed. I have, even in our group, we have one of our most wealthiest trustees. His wife is a nurse, and she just does it because she wants to help people.
Oh.
And I asked her, and I said, "Are you going to work now? You obviously don't need the money." And she said, "This is what I live for."
Wow.
She said, "I cannot abandon our patients now. This is the reason why I'm a nurse." Right? So this is the real thing. So people that are home now, that are safe, that's great.
Yeah.
But please don't forget about everyone who's on the front line. It's very, very bad out there. And, I think it behooves us to do whatever we can, whether, once again, to provide food, donations, etc. Whatever you can do a little bit. That's all.
Definitely. I really truly appreciate you for giving us your time. And I think that was such a beautiful message to just do it a little bit for somebody who really needs it. Because some of us are fortunate enough to be inside and be safe. Thank you again for your time. And I wish you the best with the Punjabi Chamber of Commerce. And we hope that you get more and more donations as well, because this is a great effort you're doing.
No, thank you, Diti. Thank you for giving us this opportunity to discuss the current situation and our Punjabi Chamber Foundation. Thank you.